Hi, hello, and welcome. My name is Jennifer, and welcome to Health and Wealth, where we go over different aspects of our healthcare industry here in the US and how you, the consumer, can utilize your insurance for your benefit. Today, we're going to be going over Medicare and its four parts, along with a brief overview of Medigap. I also have this information available on my Spanish channel, the link in the description below. And if I can ask you for a quick favor, please consider sharing this video to someone who is in need or wants to learn a little bit more about their benefits. All this information can be found on CMS. And with that, let's get started. So Medicare can be broken down into four parts, parts A, B, C, and D. And even though it sounds very simple, it can be really complicated when you start getting into the nitty-gritty of Medicare. So what I aim to do in this video is to simplify those four parts so that you will have a clear understanding of what's to happen when it comes time to enroll. So before we jump into the four parts, let's talk about the criteria for enrollment. So the first qualification is age. So people age 65 and older qualify for Medicare. You have a 7-month window, so that would be 3 months before your birthday month, and 3 months after that to enroll into Medicare without having to pay a penalty. So what would that look like? You would go on to Social Security, and if you or your spouse have completed 10 years or 40 quarters of employment, you qualify for Medicare without having to pay a premium for Medicare Part A. So let's say you're 65 and you do not meet that 40 quarter employment requirement. You will still qualify for Medicare. However, you may be charged a premium for Medicare Part A. It is important to note that if you are still working when you turn 65, you can delay your Medicare enrollment. You won't get penalized as long as you are actively employed, your employer has 20 or more employees, and you have active health insurance through your employer. You can sign up for Medicare at any time you are actively employed until you retire. After retirement, you have up to 8 months to enroll into Medicare without penalty. Now, the second way that someone can go about obtaining Medicare is if they have disability. So let's say you're under the age of 65 and you are on disability. This is another way that you can qualify for Medicare. If you are currently receiving Social Security disability insurance benefits for 24 consecutive months, congratulations, you can go ahead and apply for Medicare. The final way that you can qualify for Medicare is if you are an end-stage renal disease patient. So people with ESRD, so this is kidney failure requiring dialysis or kidney transplant, or people with ALS, you would be eligible for Medicare. So now let's move on to Medicare Parts A and B. So at this point, you've already gone to the Social Security website or office and they see that you qualify. So these parts together are normally called traditional Medicare or original Medicare. And I will be using those terms interchangeably throughout the video. So just so that we're clear, Medicare Parts A and B are traditional or original Medicare. So Medicare Part A is your hospital insurance. This covers inpatient hospital stays, skilled nursing facilities, hospice, and home health care. Typically, this is a premium-free part for people who have met that 10-year or 40-quarter requirement we discussed earlier. If you still need to meet this work requirement, you may be charged for a premium for Part A. It is important to know that Part A does not cover long-term care, also known as nursing home care, which is considered custodial care. There are special separate long-term care or LTC policies that do cover custodial care. However, you would need to do your own individual research for plans in your area. Those may have deductibles and co-insurance amounts that you would be responsible for. Medicare Part B is considered your doctor coverage, which includes doctor's office visits, physician fees for diagnostic testing, ambulance services, preventative services, durable medical equipment, and non-self-administered medications. Now, Medicare Part B does have a premium and deductible that you are responsible for paying. Additionally, it may be higher if you are considered a high-income earner. After that deductible is met, Medicare Part B does pay for 80% of your covered medical services, but you would be responsible for the last 20%. There are plans that can help you pay for that additional 20%. Those are known as Medigap plans, and I will cover that a little later on in the video. Now let's move on to Medicare Part C, also known as Medicare Advantage. This is an optional part of Medicare that you may or may not be interested in enrolling in. These managed care plans are offered by private insurance companies that are contracted with CMS, that is the Centers for Medicare and Medicaid. These plans provide an alternative way to receive your original Medicare. They typically offer HMOs, PPOs, private fee-for-service plans or PFFS, and special needs plans or SNPs. Some terms that you're familiar with most likely are the HMOs and PPOs. They do have provider networks that you, the beneficiary, may be required to use those doctors and hospitals within the plan's network to receive the full coverage. PFFS plans allow beneficiaries to visit any Medicare-approved provider who accepts the plan's terms and conditions. And last, SNPs or special needs plans are designed for people with specific healthcare needs, such as chronic illnesses or institutional care. Now, to enroll in a Medicare Advantage plan, people must be enrolled in Medicare Part A and B, be U.S. citizens or lawfully present in the U.S., and live in the plan's service area. Medicare Advantage plans typically have a cost-sharing feature such as co-payments, co-insurance, deductibles. However, many Medicare Advantage plans are $0 a month in most areas, and some include dental, vision, hearing, wellness benefits that are not typically covered by original Medicare. Many Medicare Advantage plans do offer prescription drug coverage or Medicare Part D. They are known as MAP D, but not all plans do. So you should carefully review the drug formulary and coverage details to ensure that your medications are covered. Enrollment typically occurs during specific enrollment periods, such as the annual enrollment period, open enrollment period, or special enrollment period. Most people need to consider Medicare Advantage carefully and review plan options, including coverage details, provider networks, and costs. Each plan will vary, so choosing a plan that meets your healthcare needs and preferences is essential. So this takes us to the fourth and final part, Medicare Part D. Medicare Part D helps cover most of your prescription medications. Part D is typically offered through private insurance companies that CMS approves, so you can get Part D benefits through a standalone Part D drug plan with original Medicare or through a Medicare Advantage plan known as MAP D. So Medicare Part D plans can vary on which medications they cover and how much you, the consumer, will have to pay for these covered medications. Even the least expensive Part D plan must cover most generic and brand name drugs. Also, Plan D covers some vaccines that Medicare Part B does not. So there are penalties to Medicare Part D if you are not careful. So if you do not have any other credible prescription drug coverage, you could face a lifelong Part D late enrollment penalty, even if you take few to no medications. There are very inexpensive Part D drug plans that you, the consumer, can enroll in to avoid these penalties. Lastly, I really want to go over Medicare supplement plans aka Medigap plans, which work with your traditional Medicare Parts A and B. And so here's a couple of things to note about Medigap plans. As we discussed earlier, while original Medicare provides really good coverage, it doesn't pay for everything. Medicare Part B typically covers 80% of the cost, but you would be responsible for that last 20%. With original Medicare, out-of-pocket costs like deductibles, co-insurance, co-payments can add up for you. And that's where a Medicare supplement plan comes into play. Private insurance companies sell these and can help pay for some of the remaining healthcare costs for Medicare covered services and supplies, such as those copays, coinsurance, and deductibles. Second, you'll need to know what Medicare supplement plans are available. Medicare supplement plans offer different costs and levels of coverage, so make sure that you have a trusted agent to help you find the best for your budget and needs. Most states have 10 plans labeled A through D, F, G, and K through N. This means that with each plan with the same letter provides the same coverage regardless of which company is selling it. Companies can offer all 10 plans or choose not to provide some. Please note this isn't to be confused with Medicare A, B, C, and D. These plans are called Medicare Supplement Plan A, B, C, D, F, G, K, L, M, N. Lastly, suppose you are enrolled in Medicare Part C Advantage Plan with a drug plan or MAPD. In that case, you cannot enroll in a Medigap plan, and if you do, you would be disenrolled from your Medicare Advantage plan. Though these plans are optional, there are some benefits to having a Medicare supplement plan, as they do cover some of the costs of original Medicare, and you can enroll throughout the year. However, the best time to enroll may be during open enrollment period, which is the first 6 months of you, the individual, turning 65, as you enroll with traditional Medicare. The best advice that I can give to you is to speak to a licensed independent Medicare insurance broker who will help you review all the plans and pricing for your area. This video can be part of your homework and research when making this important decision before you speak to an independent insurance broker. Hence, getting an education on how Medicare works and differentiating between plan options is the best way to protect yourself or a loved one about to enter the Medicare world. And that's it. Congratulations, you made it to the end of the video. That was Medicare 101 with a little bit of Medigap. I also have this available in Espanol. The link to my Spanish channel can be found in the description down below. If you found this a lot easier to consume, please consider sharing this video with a senior and or caregiver. Also, I would really appreciate if you would consider subscribing to my channel, giving me a like, letting me know what you would like to see from our healthcare world next on the channel. Also, I am a licensed agent for the state of California, so if you are interested in receiving a complimentary quote on all the plans available in your area, my link is also in the description down below. Consider giving it a click and I will be more than happy to provide all that information to you. Other than that, I will see you in the next one. Thank you so much.